Should schools go remote because of increased COVID-19 cases? It is the WMAY morning news feed, and I want to hear from you now at 217-629-7970. If some of you are just now getting back into the routine of work, Happy New Year. I'm not going to say that every day here, but definitely want to welcome those of you back who may have had Monday off. So Happy New Year to you. But somebody who had Monday off was the Springfield School Board. They're scheduled to go in tonight to possibly discuss an adaptive pause. It is the WMAY morning news feed. I'm Greg Bishop. Get a hold of me live and local, 217-629-7970. Again, 217-629-7970. You can also email me, bishoponair@gmail.com, or you can find me via Twitter, Facebook, Instagram, YouTube. You can message me that way. Just search out Bishop on Air. So I want to hear from you. We've seen, of course, the increased number of COVID-19 positive cases, historic levels, a lot of people testing positive. We've also seen now an increased number of hospitalizations for COVID-19. And those numbers now eclipsing what was seen back in November 20 of 2021, where, 2020. So, we've been in this now for close to 2 full years. But the question is likely going to be brought up tonight at the Springfield School Board on whether or not they should do an adaptive pause. So this was something that has been discussed elsewhere. Even in Sangamon County, there was a school district, Tri-City Schools, several weeks ago that went into an adaptive pause. Meaning that they've got a number of COVID-19 positives in the school. They need to take a break, they claim, and the county health department supported that decision, and they went into remote learning, revisiting something that really has harmed students' education in 2020, if you recall, whenever the governor ordered no in-person education for months, and having to do remote learning on the fly really did a number on youth and their capabilities of learning. So you've got now increased COVID-19 cases, increased hospitalizations, more COVID-19 hospitalizations than there were in November of 2020. That's even with the vaccine widely available. So now you've got school districts looking at the idea of going remote in a stack of stories of these different school districts. Chicago Public Schools thought that they were going to, but didn't. You've got some suburban school districts in the Chicagoland area looking at possibly going remote, but the decision could be made here soon about Springfield Public Schools. And what do you think? 217-629-7970 at 8:14. You're on WMAY.
Yeah, I'm not really sure that it's a good idea to go remote again, simply because the amount of positives, I want to know how many kids are positive, like how many school-age children are in those positive numbers, and how many of them are affected in a negative way. My family just got over multiple people in the house having COVID over Christmas break. We've gone 2 years without it touching us. It got us. But it was like a combination of the flu or strep throat type of experience. It wasn't anything more than that. And in fact, my kids that got it were extremely mild, one having nothing but a stuffy nose.
So you want to
happening.
You want to see more discussion about the severity of all of this, not just the
Absolutely.
numbers that there are. Because listen, they're going to flash numbers. For instance, it's been talked about in national headlines that the number of kids getting COVID is higher, and the number of kids in the hospital with COVID is higher. But even Anthony Fauci had to come out and say, listen, just because there's kids in the hospital and they test positive for COVID, that doesn't mean they're in the hospital for COVID. So
Correct.
You can't conflate those things. The kid could just be there for a tonsillectomy. He could just be there because he broke his leg playing soccer or whatever. But that doesn't mean they're in the hospital for COVID. That just means they got a positive test while they are in the hospital.
Right.
So you want more context to all of this.
100%. And I can tell you why, because the last 24 hours, for me to get my son, who was COVID negative, back to school today, the hoops that I had to jump through for the last 24 hours just to get him back in school was insane. And the main problem is that ISBE is operating on a separate policy from the CDC, and all these other entities.
Yeah, I've heard
because
that. I've heard that as well. I have yet to confirm that myself, but IDPH says that they're going to comply with the CDC's guidance about being able to get back to life after being quarantined. If you're close to somebody who had COVID or if you tested positive for COVID and don't show symptoms, right? So the
Right.
CDC updated that, dropping it from 10 days to 5 days if you're asymptomatic.
Correct.
But you're saying that Isbes has yet to reflect IDPH, which is reflecting the CDC. I got to get confirmation on that. You're the second
correct,
person I've
because
heard
they
that from.
issued a statement yesterday, and they said that the schools are not considered part of the general public, quote unquote, which is absolutely ridiculous. That the schools are not considered part of the general public, and the amount of hypocrisy that and inconsistency that all of this creates within the school. So your parents can go back to work after 5 days if they were positive, but a kid can't because the school operates on a different procedure. So that just is mind blowing. And I even had some discussions that, a student in school, I know students in school who have gotten detention and been, in trouble for having their mask below their nose. A teacher's turned them in or something like that, and they've gotten a detention. But then a couple hours later, that same exact student can go to basketball practice or basketball game and play with their chin strap instead of their mask because they don't wear them during a game or a practice. And that same person that gave them a detention is sitting there watching them play in that game or participate in that practice, and they don't get in trouble.
Yeah, there's some interesting inconsistencies. I think that is frustrating, not just to parents, but to students as well. And I got to say, I appreciate the call. Something that frustrates me anytime I open up the local newspaper is seeing kids on basketball courts with a chin diaper. Affectionately labeled that by South Park because it just highlights how, these kids, they're supposed to wear their masks on the court, but they're not really wearing their mask. I wouldn't want to wear a mask either playing basketball, let alone I can't play basketball, so I'm horrible. 217-629-7970. Let's get to your phone calls here. Do you think schools should go back to remote because of increased COVID-19 cases? Good morning.
What's really, truly frustrating? It's been 2 years and we're having the same conversation. COVID is not going away. It's endemic now. And this virus poses far less risk to our kids than a plethora of diseases. RSV kills more kids, and we don't shut down schools for that. It's insane.
Oh, and the flu's coming back. Had a year off last year, but now it's coming back with increased cases. I don't have the actual dial on that, but I've seen the headlines recently, and now with the Omicron COVID variant, all indication is from the reports I'm seeing, it's mild. And it's cold-like symptoms, maybe with a little bit of a fever or a chill in there. But is this something that's now risen to the level of saying we gotta tell kids they can't come to school and have in-person education?
The data is very clear. Immunity is the only way out, and the only way to get long-lasting B-cell memory immunity is to get a real infection. Let Omicron burn through our population, and let's move on. It's not going to,
sir.
And there will be
Sir, I don't think anybody's letting the virus do anything. I think the virus is doing what the virus does, and that is spread. It is going to, as you said, burn through the community. That's just how viruses spread, and I don't think that man is going to be able to stem that without the idea of going and living on an island all by yourself. It's going to spread through the community. We can do things to try to limit that, but we've seen, even with Illinois, for instance, having increased vaccination, having mask mandates in schools, having mask mandates indoors, we've seen, even with all those things in place, a huge spike in the number of COVID-19 positives.
Yep, it's time to start trusting your billions of years of evolutionary immunity response and trust your body. Start feeding it the stuff it needs. Start giving it vitamins, and let's get back to living life, because we've missed 2 years of it now, and the thought of another year is really going to be detrimental to a lot of people's mental health long term. So
Appreciate the call, 217-629-7970. So, again, the Springfield School Board going into session tonight and talking about an adaptive pause could be on the agenda. I haven't looked at the agenda myself directly, but I imagine that that's something that is going to be discussed. But they don't come back until the 10th, I believe. Students don't come back for Springfield Public Schools until the 10th. But you've got other districts all across the state looking at how they're going to return, if they're going to return, or just saying, you know what, we're moving on and we're getting school done. So we'll keep you updated on the latest there here on the WMAY morning news feed at 8:21 now. Your